This is QD Clinic. Hi, I'm Jack Cush with Room Now. QD Clinic this month is devoted to lupus. Our lupus campaign is Lupus Unlocked, and it's sponsored by Aurinia. Thanks, Aurinia. Today's case is SLE Get Ready. A 24-year-old presents to me, this is a few years ago, and I'm going to reconstruct the case, but she presented with a diagnosis of lupus. And at the time, she was just on hydroxychloroquine, azathioprine, and prednisone. And her declaration to me was that she wanted to get pregnant. And in fact, she was about to get married. She worked at the same institution I did. She was a scientist. And that was their plan. Her and her husband wanted to have children, and she knew she had lupus, but she knew there was some concern there, and that's why she was coming to see me. So when I saw her, I documented that she had lupus, and her lupus was clear. She had a lupus skin rash. She had polyarthritis, anemia. She had sclerodactyly. She had a history of serositis and bruising, and purpura and petechiae. Lab-wise, she was ANA positive, DNA positive, SM and RNP positive with leukopenia, anemia, hypocomplementemia, and proteinuria in the last year. My words to her were, no, you can't get pregnant, which was quite traumatic for the patient. So after I backtracked and explained to her, now is not the time to get pregnant. Yes, you can get pregnant in the future, but you got to be ready for it. And this was a really hard pill to swallow, especially since it was the first visit. And the only thing she knew about me was that you need to go see him, and he'll tell you how to better manage your lupus. And it was a slow process. And I told her the first thing we had to do, well, first off, you can't get pregnant when you have this much activity, including at the time she had proteinuria, she had active serologies, she had an anemia of chronic disease at some point. And I told her we had so many things we had to work through, including a better regimen than what she was on, which is azathioprine, prednisone, hydroxychloroquine. Kept her on the low-dose prednisone and hydroxychloroquine, changed the azathioprine. Initially, the discussion was methotrexate or mycophenolate. And she initially went on methotrexate, mainly because of really bad polyarthritis. And she had sclerodactyly, and I thought she was an overlap at that point. But the polyarthritis was severe. I think her initial joint exam, I believe she had, like 12 tender, and no, it was 12 tender and 6 swollen joints, PIPs, MCPs, elbows with contractures. So she understood ultimately, and we made these changes first to methotrexate, prednisone, hydroxychloroquine. Then after 6 months, we switched her over to mycophenolate for other multi-system disorder management, but her arthritis got worse. And then ultimately she went on Humira or adalimumab in addition to hydroxychloroquine, prednisone, and mycophenolate. And again, the patient was told right from the start, you cannot get pregnant on methotrexate, you cannot get pregnant on mycophenolate. Mycophenolate is a one clear-cut teratogen in rheumatoid arthritis. Way, 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 way more than methotrexate or leflunomide. It is the no-go teratogen, more so even than cyclophosphamide. So, and I impressed that upon her at the first visit and every visit. So the first visit, she had all these changes. The first visit, she went on birth control. And she had an implant put in, and that worked well. And anyway, it took about 4 years before we got to the point that she could go off the mycophenolate. She could be on the hydroxychloroquine, very low dose prednisone, and adalimumab, and conceive. And in fact, she did conceive. And in the years since this happened, she's gone on to have 2 children. Now, she's had very difficult lupus, hard to manage. But once you get to the point that, the patient is stable, and there is little signs of active disease. Now she's got, deforming arthritis at this point, and sclerodactyly never progressed, but we had to, get her under control. So again, the big move in her was treat the polyarthritis first with methotrexate, second with TNF inhibitors, and she conceived on a TNF inhibitor. Because she was on prednisone, she went on calcium and vitamin D, and she got a baseline DEXA to assess where that was going to go in the future, because it looked like she was going to be on long-term low-dose prednisone. Early on, the big issue in her was weight loss. When I first saw her, she had lost 12 pounds in 12 months, and she had an anemia of 10/30 with sort of normal indices on the low end. The question was this GI bleeding? Did she have gastritis? Was this anemia of chronic disease? We did a workup with H. pylori and GI, a Coombs test, and haptoglobin LDH. She had no hemolysis. She just had the anemia of chronic disease. We'd never proved a GI bleed, but with better disease control, her H&H ultimately came up to like around 11.5 over like 35. And that's where she's been for the many years I've been managing her. So again, the hard thing, and this lesson is all about, you have to prepare your patients when they want to get pregnant. And it has to be a slow process where they have to understand that mom has to be ultimately healthy to make a healthy baby. Tune in for more QD Clinics.